Is Food Addicts Anonymous right for me? If you deal with food addiction, you may feel overwhelmed and alone with no idea where to turn for help. Food Addicts Anonymous, FAA, may be able to assist you. We want to help you determine if the organization is right for you. What is Food Addicts Anonymous? FAA's mission is to help food addicts abstain from addictive foods through a series of tools and support from other addicts. There are chapters throughout the United States and in some other countries. The organization is not affiliated with any treatment facilities, or weight loss or diet programs. Face-to-face meetings, phone consultations, and online support groups are available to make sure you have access to help 24 hours a day. Research suggests that mentors may be useful for people recovering from eating disorders, including binge eating disorder. FAA holds a world convention each year in the retreat in California. FAA believes food addiction is a biochemical problem and not a matter of willpower or laziness. They think you can recover from food addiction by eliminating sugar, flour, and wheat from your diet, practicing abstinence from those ingredients, and going through their 12-step program. Food Addicts Anonymous Food Plan FAA provides a food plan to help break the addiction cycle. The plan allows protein, vegetables, fruits, dairy, healthy fat, grains, sugar-free beverages are also allowed and include herbal tea, unsweetened, decaffeinated tea or coffee, water. Artificial sweeteners are not permitted. FAA rejects the idea that their eating plan is just another diet but believes it's a healthy eating plan that helps break the food addiction. FAA's 12 Steps. FAA's 12-step program is an adaptation of the Alcoholics Anonymous version. It leans heavily on faith in God, or a higher power, and the belief that God will help you break the addictive eating cycle. FAA is not affiliated with any one religion. The program includes self-exploration and making amends with people you've hurt. It's believed that combining FAA's 12-step program with their eating plan helps you identify the reasons you overeat and equips you with tools necessary to make better eating choices and beat food addiction. All of this happens in a non-judgmental environment with peers to promote honesty and healing. Is it right for you? How do you know if FAA is a good match for you? They recommend asking these questions. Have you struggled to eat healthy foods and maintain a healthy weight for years? Do you binge by eating large quantities of sweets and starches? Are you someone who purges using laxatives, vomiting, or extreme exercise? Do you limit your food intake and have people telling you to eat more? If you answered yes to any of these, you might have an issue with food addiction. FAA may be a healing option. You can also take this online food addiction course anonymously. Food addiction. The FAA program may not be a good fit for people who are not spiritually inclined or not prepared to admit they have an addiction. FAA does not offer medical diagnosis, advice, or treatment for eating disorders. If you have a diagnosed eating disorder, such as binge eating disorder, or a medical condition that contributes to or is a result of overeating, you should consult a doctor or mental health professional before trying the FAA program. In fact, FAA recognizes that some people have side effects related to eating disorders that require professional intervention. Getting help. Did you know? A study published in the Journal of Mental Health suggests early intervention in eating disorders may be useful. In cases where risk factors are identified, early intervention may help prevent an eating disorder from developing. Many people go through FAA's program without professional supervision, but that may not be the best decision for everyone. Food addiction symptoms overlap those of clinical eating, often blurring the line between the two. Since all eating disorders have the potential to cause traumatic side effects, it's critical that you determine the reality of your situation before starting a self-help program. If you experience any of the following related to food, seek help from a professional. Depression, anxiety, guilt, shame, regularly eating in secret, social difficulties, frequent dieting or binging, extreme weight gain or loss, food avoidance or obsession. According to research published in Obesity Reviews, the verdict is still out about whether or not food addiction is a valid concept. However, millions of people who struggle daily with food might disagree. FAA is one option to tackle food addiction, but it may not be appropriate for everyone. Because untreated eating disorders often have destructive outcomes, discuss FAA with your doctor to see if it's right for you.